radial nerve. Radial nerve arises from the nerve root C5, 6, 7, 8 and T1. T1 is in constant contribution. Then first it is in the axilla, and in the axilla it gives motor branches to the long and medial head of the biceps, of the triceps, long and medial head of the triceps, and sensory branch to the posterior brachial cutaneous nerve, that is posterior part of the arm. Then it comes in the radial groove region. In the radial groove region, it gives branch to the lateral head of the triceps, and also a branch to the anconeus, this long branch to the anconeus muscle lying on the medial side. And then it gives branch to the and it gives sensory branches to the inferior lateral cutaneous nerve, that is inferior of the arm, and posterior antebrachial cutaneous nerve, that is for the posterior of the forearm. Then after the radial groove, it comes in the by piercing the lateral intermuscular septum. After piercing the lateral intermuscular septum, it gives branches to the muscles lying on the lateral side, that is brachialis, brachioradialis, extensor carpi radialis longus, and extensor carpi radialis brevis muscle. Brachialis, brachioradialis, extensor carpi radialis longus, and extensor carpi radialis brevis muscle. This is in the arm, and then we come in the forearm. And it comes in the forearm, it gives two branches, deep terminal branch and superficial branch. Deep terminal branch will be supplying the supinator muscle to the supinator muscle, and it will continue as posterior interosseous nerve. Posterior interosseous nerve, continuation of deep branch of radial nerve, distal to lower border of supinator muscle. Okay, supinator and posterior interosseous nerve. Posterior interosseous nerve, we need to remember that it is injured in Monteggia fracture. Then we see the sensory supply. It gives the inferior lateral cutaneous nerve, posterior brachial cutaneous nerve, posterior antebrachial. Inferior lateral cutaneous was given in the second part in the radial groove, and posterior antebrachial was also given there. Posterior brachial cutaneous nerve was given in the axilla. Then superficial branch. Superficial branch supplies the dorsal half of the hand, and the dorsal 3.5 fingers. हैंड का सिर्फ हाफ है, बट फिंगर्स है जो वो 2.5 नहीं है, इट्स 3.5 fingers. Then we see the theory part, largest nerve in the upper limb, most commonly damaged. Axilla, we've seen posterior cutaneous nerve to long head of triceps, medial head. Then in the radial groove, lower lateral cutaneous nerve of arm, posterior cutaneous nerve of forearm, nerve to lateral head of triceps, and nerve to medial head of triceps. Lateral and medial both are supplied in the radial groove. And nerve to anconeus, the large one nerve which was coming. Then they pass the lateral intermuscular septum, nerve to brachialis, brachioradialis, extensor carpi radialis longus, extensor carpi radialis brevis. And in the cubital fossa, two branches, deep branch and superficial branch. Deep branch was supplying the extensor carpi radialis brevis and supinator, posterior interosseous nerve, articular branches. Supinator वाली nerve आगे जाके posterior interosseous nerve बन रही थी और Monteggia fracture में ही इंजर होती है. Then is superficial branch. Superficial branch was supplying the lateral part of dorsum of hand, half, and lateral 3.5, not 2.5, 3.5 digits dorsally on the dorsal side, and excluding the nails. Then we see the injuries. Injuries basically first will be in the axilla. In the axilla, we can have crutch palsy or Saturday night palsy, and it will be loss of extension at the elbow. Elbow extension gone due to triceps, then wrist drop due to ECRL, extensor carpi radialis longus, which was given after the intermuscular septum. Then finger drop and difficulty in supinator is gone, deep branch is gone. Okay. And sensory loss will be posterior surface lower part of arm, forearm, and dorsum of hand, lateral part of dorsum of hand, lateral half, and lateral 3.5 digits dorsally, and anatomical snuff box. देन इन दी स्पाइरल ग्रूव वाली लीजन में जैसे फ्रैक्चर मिड शाफ्ट में हो सकती है, इंट्रामस्कुलर इंजेक्शन में, और सैटरडे नाइट वाल्स में भी हो सकती है. इसमें ट्राइसेप्स बच जाएगा, तो ट्राइसेप्स वाली मतलब मोटर लॉस नहीं होगा. दैट इज लॉस ऑफ एक्सटेंशन एट द एल्बो. रिस्ट ड्रॉप होगा, फिंगर ड्रॉप होगा, डिफिकल्टी इन सुपिनेशन विल बी देयर. एंड सिमिलर दैट ऑल्सो दैट पोस्टीरियर सरफेस ऑफ लोअर पार्ट ऑफ आर्म वाला रीजन नहीं इफेक्ट होगा सेंसरी. ओके. एंड फोर आर्म वाला इफेक्ट हो सकता है और इंफीरियर आर्म वाला भी हो सकता है, बट आर्म वाला जो है, जो ब्रांच एक्सला में आ रही थी वो नहीं इफेक्ट होगा, और डॉर्सम ऑफ हैंड का, फिंगर्स का, वो इफेक्ट होगा. फिर एल्बो में आ गया. एल्बो रीजन में मीन्स क्यूबिटल फोसा के बाद सिर्फ दो ही ब्रांच आ रही थी, और सुपिनेटर वाली, और तो वही इंजर होगी. फिंगर ड्रॉप होगा और डिफिकल्टी इन सुपिनेशन. फिंगर ड्रॉप एंड डिफिकल्टी इन सुपिनेशन. posterior interosseous nerve extensor carpi radialis brevis की वजह से. Okay, so that's all. Thank you.